At the bottom of my neck evaluation form, there are 5 symptoms that I ask patients about, and I highlight them here today to point out that these symptoms can be related to neck disorders, a number of neck disorders. And unfortunately, I think a lot of patients, especially, but also clinicians, are not associating these symptoms with the possibility of coming from the spine in the neck. I ask patients about the presence of dizziness, tinnitus or ringing in the ears, nausea, difficulty swallowing, and difficulty or trouble with vision. Most symptoms, or all symptoms, one-to-one, are not going to tell you a diagnosis. But when we take them all together, those 5 pieces of information combined with the dozens and dozens of other pieces of information I've gathered from the evaluation, we can think more conclusively about a specific diagnosis or two and move forward. Those symptoms, in and of themselves, could be coming from something completely unrelated. If a person has 3 of those symptoms, they could be coming from 3 different disorders. But for me, because people are typically not bringing those up when they're in a clinician who deals with orthopedics office, I want to make sure that we get those written down and understood. Because if a patient is complaining of neck pain, but for 30 years they've also had intermittent dizziness, well, one of our goals should be to assess if they're related, and if they are, to abolish the dizziness. Difficulty swallowing, for example, can be also, of course, for many different types of disorders, not musculoskeletal only, but also neurological. But if I'm thinking it may be musculoskeletal, then perhaps there's space occupation in the throat. Perhaps, for example, a disc has protruded anteriorly. Things like difficulty with vision or trouble with vision can also likewise be coming from lots of different problems. But I've seen weird things coming from the spine. And do I know the exact kind of anatomical or physiological mechanism to explain why some of my patients have floaters in their eyes that are abolished with simple neck movements? I do not. But I know that it needs to be on my radar. And I think it's important for me to point out to patients who do report these symptoms that they could be completely unrelated, but they may be related to the same reason that they're in my office. And if they are, we need to make tracking those things an important part of our process, because in an ideal world, they are related and they are solved with simple movements of the neck. Now, not all neck disorders are mechanical joint arrangements, but the large majority are. And the reason I point that out is because joint arrangements are fixed with 1 or 2 specific movements done repeatedly and temporarily avoiding movements in the directions that are exacerbating. For a lot of patients with mechanical problems in the neck, not all, they are responding to a movement in the sagittal plane in a direction that they are not typically in. So that looks like retraction, because most of our days are spent in protrusion. It looks like retraction extension, or it looks like extension because most of our days are spent in flexion. But the point of repeated movement testing is to figure out, first and foremost, is the disorder in the neck? And if it is it a mechanical problem? And secondly, if it's a mechanical problem, what is a specific direction or two that this individual needs to get the spine, to get the neck working again? And if those other symptoms are present, so symptoms besides range of motion loss, or symptoms like pain or numbness or tingling anywhere in the neck, head, shoulder blades, shoulder, down to the fingers, if those 5 things I asked about are present, we want to hopefully abolish them as well.